Well, for 35 years, Alex Trebek entertained TV audiences as the beloved host of Jeopardy, a show he described as a simple recipe for fun. This week, he lost his battle with stage 4 pancreatic cancer. According to the National Cancer Institute, pancreatic cancer is the third leading cause of death from cancer in the U.S. Joining us this morning, again, we had some technical issues a little earlier, so we appreciate her time, Dr. Beth Ramirez, who's an oncologist at Touro. So explain to people why it is that pancreatic cancer is so hard to detect.
Yes, good morning, and thank you for having me to talk about this important topic. The pancreas is a gland organ that sits in the middle of the abdomen, and it helps in our digestion. It secretes enzymes to digest the food that we eat and secretes hormones to regulate blood sugar. And pancreatic cancer happens when there's an abnormal growth of some of those cells in the pancreas that forms a tumor. And because of where the pancreas sits deep in the abdomen, it's difficult to feel that organ. So sometimes that can be a reason that pancreatic cancer might go undetected for a while. But really, the symptoms of pancreatic cancer are pretty vague and can often be attributed to many other causes. But some of those symptoms would be gnawing abdominal pain, persistent abdominal pain that doesn't go away. That's often described as a gnawing, dull pain in the middle of the abdomen. It can radiate into the back. Weight loss, unexplained weight loss, a loss of appetite, vague things like fatigue and depression. And then a pretty advanced symptom is jaundice, which is yellowing of the skin and of the eyes, which happens when the gallbladder starts to get backed up because of the tumor in the pancreas.
When it comes to pancreatic cancer, is there a screening for it at all?
So there's actually not any routine screening. We don't have a good test like we have for colon cancer or colonoscopy or mammograms for breast cancer. We do know that about 10% of pancreatic cancers are hereditary. So there are some genetic mutations that can be checked for if there's a family history of pancreatic cancer. Actually, the BRCA gene, which is well known to be associated with breast and ovarian cancer, also mutations in the BRCA gene increase the risk of pancreatic cancer. So if you have a family member who has had pancreatic cancer, it's important to let your doctors know that. And you might qualify for screening in that case if you have a family history, and that would be with a GI doctor or gastroenterologist. They can do ultrasounds to look at the pancreas.
And so a lot of unknowns with this cancer because it's so hard to detect and there isn't a standard screening for it. You were telling me there's a website though that people can go to that has a lot of good resources. And as far as people are concerned, if you do have any of these symptoms, talk about the importance of over communicating with your doctor.
Right. So there's a Pancreatic Cancer Action Network. Their website is pancan.org. Important to know, November is Pancreatic Cancer Awareness Month. The color is purple, so that's a great website to go to for some more information and to get involved. If you feel that you're experiencing some of these symptoms, it's always important to listen to your body and communicate it to your doctor. If there's not a good explanation, another cause for these symptoms, or if they're persistent, they're just not going away after a few days or a week, it's important to go in and get checked out. And for physicians to know, always keep these. It's a rare diagnosis, but it exists, and it's very important to catch it as early as you can so that it can be treated as effectively as possible. So referral to a GI doctor to have a scan done, checking some blood work, really paying attention to what your patients are telling you is important.
Dr. Beth Ramirez, we appreciate your time and you're adjusting to some of the technical issues we had earlier.
Certainly.
Have a good week.
Thank you, you too.